iPads or tablets to use in the clinical setting. And this really came about very accidentally and very naively. I was taking my students in the clinical setting, and I'm always looking for resources. We have opportunities where we need to access different resources for medications or how to review a skill. And I noticed that there were no books in the hospital. There were no resources for my students. And I'm thinking, what's the matter with these hospitals? I can't believe, I know the budget's tough, but how come there are no books, no resources for our students? Well, come to find out, it's because our hospitals, our little community hospitals, are actually ahead of the curve here. They're not using books anymore because by the time the information is published, it's really outdated, and particularly with medications. You know, we just can't keep up with the medications that are coming, that are being produced. So what they've done is they've allowed the physicians and primarily the prescribers to have access to technology, to electronic resources and references. So I said, wow, isn't that great? That's really cool. But the problem is that the nurses didn't have the same access. So I said, I want some of that. I want to be in on that. So I spoke to Hope and talked to Wendy, and we said, you know, what can we do? How can we bring these resources to our students? So we thought the most logical thing to do was to be able to, use a tablet so that our students could resource drug reference books or actually to view a skills video. So, for example, if our student had to insert a Foley catheter, and I'll spare you, I did not bring any of the videos. But if they had to insert a Foley catheter and they had learned the skill the year before, you know, they might be a little rusty on that, may not be as proficient. So this way, if we had the tablet, they could just resource one of the videos and they could refresh their skills, and that way before they went into the patient's room they would feel much more confident, certainly. I don't know if their proficiency would necessarily change, but they'd give that air of confidence to their patients, which is certainly very important. So that's how this all came about, and we were very lucky to get 5 droids, I guess they were, right? We didn't actually, Zooms, excuse me. They weren't actually iPads. Because of the flash issue, we wanted to be, it was very important that we were able to access videos, and the iPad apparently has some kind of compatibility issue that we wouldn't have been able to utilize. So we got 5 of them, and we distributed them to the people in the clinical setting, and we started using them. This is kind of a side benefit that I'm going to let Hope talk about, the actual resources, databases that they have access to. But just from my perspective, what has happened is we've kind of found new uses for it. We hit a couple of roadblocks. In some areas, we weren't actually able to get internet access. And one of the biggest problems with the tablet is the size of it. It just doesn't really lend itself to being put into a lab coat pocket. And then we were also a little concerned about safety. How do we secure that? And what happened, as what's happening with technology, is that as we were writing the grant and investigating all of this, iPhones came on the market. And so now everybody has a smartphone. So our students have their smartphones. So before I can even pull the tablet out of the infection control packet, they're on their iPhone and they're using it. But so the good part of that is that we actually found some new uses for our tablet, and we're using them in the classroom. We do active participation, collaborative teaching. We'll have our students get together in groups, and we give them the tablet to use. And they look up the resources, the disease process, whatever it is, and then they come back and teach each other about it. So we found some new uses that we weren't initially looking for, but it's been really well received. It's used well, and I think there's certainly a place for it in nursing education. It also fulfills one of the NLN requirements as far as incorporating technology into the classroom. So it's been good. Do you, Hope, want to talk about the...
Just quickly, one wonderful thing that came out of this, we were working with Pat Carroll Mather, who used to be the librarian at SUNY Ulster, and she was helping us because she runs the Southeastern New York Library Resource Council that provides all the databases for all the hospitals that you can see. These are all the hospitals in our region in the Hudson Valley. It turned out that, yes, you know, getting the tablet to the nurses was one thing, but also what are they going to be getting to once you have the tablet? And to be able to access these databases was just as important as being able to have the actual piece of equipment. And it turned out that when we were working with Pat, that she had thought that everybody had access to this, but only the doctors did. So what we were able to do was to shift the relationship of who had access. So now all the nurses in the Hudson Valley have access to these databases thanks to us.
Wow.
So this is a really wonderful thing, and we should pat ourselves in the MIDI grant. And so now all the nurses in the Hudson Valley have access to databases like this, and it was just a wonderful opportunity for us to actually help the larger community as a result of the grant.
And so they have access regardless of, they don't need the tablets, they can have their iPhones, computers, right? This is a generic access to these brand new
Yes.
databases.
Yes.
Because
Yes.
prior to that, they were just Googling everything.
Wow, wow, okay.
You know, so now they have medical resources, they have access to evidence-based practice resources, Cochrane Review, and things like that. So, you know, much more scholarly resources for them.
That's it.
All right, thank you.